As Global News first reported last night, Ontario is going into lockdown. 28 days for most of the province, 14 days for the north. But it doesn't go into effect until Boxing Day. Ontario has one of the worst COVID-19 caseloads in Canada. For the past week, more than 2,000 new cases a day. But in the nation's capital, where case numbers have already dropped off, there's a feeling there's no reward for abiding by the rules. Eric Sorensen has our top story tonight.
This is the problem. Ontarians still interacting with too many people outside their homes, shopping, at work, and in other gatherings. It's led to a looming crisis for hospital beds, especially in southern Ontario, and to a rising death toll once again in long-term care homes. So, a lockdown is coming the day after Christmas.
Make no mistake, thousands of lives are at stake right now. If we fail to take action now, the consequences could be catastrophic.
On December 26th, Ontario's limited lockdown goes province-wide. Non-essential businesses will close to in-person retail till January 9th in Northern Ontario and till January 23rd in Southern Ontario. Schools will reopen later in Northern Ontario and for elementary schools in Southern Ontario on January 11th. High schools in the South will do remote learning till the 25th. Childcare and grocery stores can remain open. Restaurants and bars can open for takeout. Hardware and pet stores can stay open for curbside pickup. One administrator drove home the urgency for his hospital network in Toronto and Brampton.
I can tell you that the surgeries that we are canceling are people that have been waiting for certain surgeries in pain for 2 to 3 years.
Indeed, the stress on hospitals is increasing. Latest modeling shows Ontario's ICU occupancy will be over 300 beds within days and could rise to over 600 or higher in January, potentially overwhelming some hospitals' capacity to care for serious illnesses and accident victims.
We're in a very, very challenging and precarious situation.
Public health officials are fully behind a stringent lockdown.
We don't believe anything less than 4 weeks will be effective, and longer durations will be more effective.
Regions like Ottawa are doing better than Toronto, and some there aren't happy with a full lockdown.
It's a little bit of a kick in the gut, I would say. We've been doing really hard work here in Ottawa to get our numbers in line.
The business community, along with the residential community, as Dr. Etches pointed out, have been working very, very hard, following the rules, only to be surprised and, as I said, blindsided by the province.
But if Ottawa stays open, the province fears more people would stream in, from Quebec, for example.
Nothing against Quebecers. I love the Quebecers, but they'll come over in droves. We're acting, we're being decisive, and I'll always listen to our health experts.
Even before the lockdown, the message from the province is, if you can, just stay home. It will reduce the number of COVID cases sooner. Eric Sorensen, Global News, Toronto.